Hello friends, welcome to Pediatrics by Dr. Saman Fatima. So today we are going to study about Fontenelle. Now this topic is something from where a lot of one-liners has been asked. So if you pay attention, you will be able to learn about the topic thoroughly and you can score a lot of marks from this topic. So what are Fontenelle? So how many Fontenelle are there at birth? How many Fontenelle are there at birth? What do you think? So please remember that there are 6 Fontenelle. There are 6 Fontenelle at birth, 6, but we are going to read only about 2 Fontenelle because these 2 are most important. So for studying for reading Fontenelle, first of all we have to know the basic anatomy of skull, the various bones of the skull as well as sutures. Whenever you are reading a topic, do not try to skip anatomy and physiology related to it. This is my mantra of studying MBBS subjects, clinical subjects. Because उससे बहुत easy हो जाता है. You think that you will spend another 15 minutes, wasting on your anatomy or physiology revision. But it will help you, remember that particular topic for a longer period of time, and that way you will save a lot of time. So please always try to, revise the concerned anatomy, physiology, biochemistry, whatever, basic sciences, basic first year or second year subjects जो हैं वो आपके clinical subjects से related, try to revise those before going into the topic. So please let's study anatomy, basic anatomy जो हम फर्स्ट ईयर में पढ़ते थे, anatomy of skull. Normal skull में क्या होता है? We have frontal bones, everybody knows. We have frontal bone. We have 2 frontal bones in fact, which later fuse. We have parietal bones. We have 2 parietal bones. These are 2 parietals, and then we have occipital bone. We have occipital bone, right? So we have frontal bone, we have parietals, and we have occipitals. So between two frontal bones, we have metopic suture. We have something called as metopic suture. Metopic suture is present between 2 frontal bones. This is metopic suture. Correct? What is sagittal suture? Sagittal suture is present between 2 parietals. Between 2 parietals, we have our sagittal suture. Whereas between frontal and parietal bones, we have our coronal suture. This is our coronal suture, right? This is our coronal suture. And where do we have lambdoid suture? It is between our parietals and occipitals. So this is basically lambdoid suture. This is lambdoid suture. अभी और अच्छे से समझते हैं इसको, ठीक है? Suppose this is the skull. Let me draw a skull for you. So this is something like this. My drawing is not very good, but still I'm trying. So these are 2 frontal bones. These are 2 frontal bones. 2 frontal bones. These are 2 parietal bones. 2 parietal bones. And this is our occipital bone. This is our occipital bone, right? Then we have between 2 frontal bones, we have metopic suture. Metopic suture between 2 frontal bones. Between 2 frontal bones, we have metopic suture. Between 2 parietals, we have sagittal suture. Then between frontal and parietal, we have coronal suture. This is our sagittal. This is our metopic. And between occipital and parietal bone, we have our lambdoid suture. So please remember these sutures. अब पढ़ते हैं Fontenelle कहाँ होते हैं? You can very well see this is anterior Fontenelle. This diamond shaped structure is anterior Fontenelle, whereas this triangular structure is posterior Fontenelle. So anterior Fontenelle basically कहाँ present होता है? Anterior Fontenelle is present between frontal bones. This is frontal, between frontal bone and parietal bone. Between frontal and parietal bone we have our anterior fontanelle, whereas posterior fontanelle is present between occipital and parietal bone. This is our occipital, between occipital and parietal bone. So between, this is posterior, this is anterior fontanelle. So let's study a few important points about these fontanelle. Anterior fontanelle, and then we will read about posterior fontanelle. So anterior fontanelle is diamond shaped. Diamond shaped. I think इसमें कोई confusion नहीं होना चाहिए. It is diamond shaped. It is diamond shaped. You can see, you can very well see in this picture. Please remember this picture. You see, I always try to show you a lot of pictures because photographic memory is very strong. Once you remember, it gets imprint on your mind, it is there for lifetime. So please try to remember this diagram, that anterior fontanelle is present between frontal and parietal bone. It is diamond shaped, whereas posterior fontanelle is present between parietal bone and occipital bones, and it is triangular in shape. Posterior fontanelle is triangular in shape. It is triangular in shape. First point, it is diamond shaped, whereas it is triangular shape. Second point, it is around 2 by 2 centimeter at birth. In a newborn, anterior fontanelle is around 2 by 2 centimeter. Whereas posterior fontanelle की size क्या होती है newborn में? क्या होती है size? Posterior fontanelle admits just the tip of finger. Posterior fontanelle admits just the tip of finger. It admits just the tip of finger. Just the tip of finger. Very small, very small. It admits just the tip of finger. Just the tip of finger. Or it may be closed at birth. It may be closed at birth. It may be closed at birth. So anterior fontanelle is diamond shaped and it is 2 by 2 centimeter in a newborn, whereas posterior fontanelle is triangular in shape and it admits just the tip of finger, or it may even be closed at birth. Understood? Now when does anterior fontanelle close? Very important point. हर बार एग्जाम में पूछते हैं कब बंद होता है, एंटीरियर fontanelle कब क्लोज हो जाता है. So average time जो होता है it is 18 months. So in some infants, in some newborns, it may be closed by 6 months of age. But if they ask average time, average duration कब होता है, तो 18 महीने पे होता है सर. ठीक है. Anterior fontanelle closes by 18 months of age. When does posterior fontanelle close? छोटा है, जल्दी बंद हो जाएगा. Simple फंडा. ठीक है. तो it closes by 6 to 8 weeks. 6 to 8 weeks. Posterior fontanelle closes by 6 to 8 weeks. 6 to 8 weeks. A posterior fontanelle, what are the conditions in which posterior fontanelle is wide open? Birth पे it is wide, just the tip of finger normally होना चाहिए. But if it is wide open at birth and it continue to be open beyond 6 to 8 weeks of life, persistence, then what are the conditions? Please remember, HC से याद कर लीजिए. ठीक है. This is a mnemonic I am telling you. ठीक है. HC means head circumference, right? Head circumference. So H is for hydrocephalus. Hydrocephalus is a condition in which posterior fontanelle is wide open and it can persist beyond 6 to 8 weeks of age. Second one is congenital hypothyroidism. Congenital hypothyroidism. Congenital hypothyroidism. Congenital hypothyroidism. So these are the two conditions in which posterior fontanelle is wide open. Posterior fontanelle is wide open. Anterior fontanelle की wide open होने की conditions क्या हैं? In which conditions anterior fontanelle is wide open? So please remember a mnemonic. It's a very important mnemonic I am telling you. The mnemonic is CAR. Please remember this mnemonic because these three conditions go hand in hand. There will be many places where they will go hand in hand. So I'll be keep telling you this car mnemonic is very important. So C for cretinism. What is cretinism? What is cretinism? Cretinism is nothing but hypothyroidism. Basically, it's congenital hypothyroidism. Congenital hypothyroidism. A for achondroplasia. Achondroplasia. A for achondroplasia. And R for rickets. I'll tell you later when we will, study growth and development. I'll tell you ये conditions कहाँ पे आती हैं साथ में, ठीक है? So please remember this very important mnemonic car cretinism, that is congenital hypothyroidism, A for achondroplasia and R for rickets. In these three conditions, anterior fontanelle is wide open. Now there could be some situations जहाँ पे anterior fontanelle आपका early close हो जाए, या फिर anterior fontanelle is very small. So what are these conditions? This condition is craniosynostosis. Craniosynostosis या microcephaly. In this particular condition, anterior fontanelle is very small or it may be even closed. Craniosynostosis or microcephaly. Anterior fontanelle is very small and it may be even closed. Now, how do we evaluate the anterior fontanelle? So, whenever we are checking the anterior fontanelle in a newborn, always try to keep the newborn in upright position. Sitting position में उसको कर लीजिए, upright position में कर लीजिए, and then put your hand over the head and try to palpate it. Try to feel it. So normally normal condition में क्या होता है, anterior fontanelle जो होता है, clinical significance anterior fontanelle की ज़्यादा है because वही बड़ा होता है, उसी से हम evaluate करते हैं, ठीक है? तो क्या होता है normal जो होता है, normally how should we examine the anterior fontanelle in a newborn? We should do this in upright position. Upright position में हमें ऐसा करना चाहिए. और कब करना चाहिए? when the या तो बच्चा सो रहा हो, sleeping हो, या after feeds, because these are the situations, these are the times when the baby is calm. So we'll be able to evaluate properly. नॉर्मली अपराइट पोजीशन में करते हैं. बच्चा जब दूध पी चुका होता है उसके बाद करते हैं, या बच्चा सो जाए तब कर लीजिए, ठीक है? इन दो सिचुएशंस में कर सकते हैं. और नॉर्मल कैसा होता है, नॉर्मल फील कैसे होता है? इट इज स्लाइटली बल्जिंग. दिस इज वेरी इंपॉर्टेंट. सो नॉर्मल fontanelle जो होता है दैट इज स्लाइटली बल्जिंग. इट इज स्लाइटली बल्जिंग. सॉरी, इट इज स्लाइटली I don't know whether the spelling is right or wrong. It seems wrong to me. I don't know why. I think there will not be any D. Slightly bulging. So normally it is slightly bulging and pulsatile. Normally anterior fontanelle is slightly bulging as well as pulsatile. अभी बहुत बल्जिंग किस कंडीशन में हो जाएगा? व्हाट आर द कंडीशंस इन विच एंटीरियर fontanelle इज वेरी मच बल्जिंग? नॉर्मली इट इज स्लाइटली बल्जिंग, बट किस कंडीशन में इट विल बी बल्जिंग प्रॉपर्ली? आई मीन जिसको आप कहोगे एबनॉर्मल बल्जिंग है. तो बल्जिंग fontanelle किस में मिलता है? कैन यू टेल मी? कैन यू गेस? इट इज रेज्ड ICP में मिल सकता है. या अगर बच्चा बहुत ज़्यादा क्राई कर रहा है ना, तब भी ऐसा हो सकता है. तभी कहते हैं जब बच्चा शांत हो, जब बच्चा सो रहा हो, या फिर फीड्स के बाद ही हमें इसको इवैल्यूएट करना चाहिए. अदरवाइज वी कैन फाइंड कि इट इज़ बल्जिंग. उस समय बल्ज कर सकता है, फील हो सकता है हमें, ठीक है? और रेज्ड ICT में इट विल बी एबनॉर्मली बल्जिंग. रेज्ड ICT में इट विल बी एबनॉर्मली बल्जिंग. So this is all about fontanelle. So I'll be coming with another topic, another very important topic or from growth and development. Please let me know in the comment section if there any other point which I have missed and how can I improve. And please you also do let me know that what are the topics that you want me to make videos on and you want me to teach you. Thank you so much for being with me. Have a great day.